Canada's healthcare system isn't failing because it lacks funding or public support. It's failing because governments have tied it to restrictive rules that block private medical options used in other developed countries to deliver timely care. Canada spends close to $400 billion a year on healthcare, placing it among the highest spending countries in the Organization for Economic Cooperation and Development, OECD. Yet the system struggles with some of the longest waits for care, the fewest doctors per capita, and among the lowest numbers of hospital beds in the OECD. This is despite decades of spending increases, including growth of 4.5% in 2023 and 5.7% in 2024, according to the Canadian Institute for Health Information. Canadians are losing confidence that government spending is the solution. Many don't even think it's making a difference. And who could blame them? Median healthcare wait times reached 30 weeks in 2024, up from 27.7 weeks in 2023 and 27.4 weeks in 2022, according to annual surveys by the Fraser Institute. Nevertheless, politicians tout our universal healthcare system as a source of national pride. According to national surveys, 74% of Canadians share this sentiment, even though only 56% are actually satisfied with the care. This gap reveals that while Canadians value universal healthcare in principle, they are frustrated with it in practice. The problem is not universal healthcare itself, but Canada's uniquely restrictive version of it. In most provinces, laws restrict physicians from working simultaneously in public and private systems and prohibit private insurance for medically necessary services covered by Medicare. These constraints don't exist in most other universal healthcare systems. The United Kingdom, France, Germany, and the Netherlands guarantee comprehensive insurance coverage for essential healthcare services, just like Canada, yet they achieve better access, as patients see doctors and receive surgeries sooner. Germany has both public and private hospitals. In France, universal insurance covers procedures in public hospitals and private clinics. In the Netherlands, all health insurance is private, with companies competing for customers, while coverage remains guaranteed. In the United Kingdom, doctors working in public hospitals can also maintain private practices. These countries preserved their commitment to universal healthcare while allowing private alternatives to expand choice, absorb demand, and deliver better access to care for everyone. Only 26% of Canadians can get same-day or next-day appointments with their family doctor, compared to 54% of Dutch and 47% of English patients. When specialist care is needed, 61% of Canadians wait more than a month, compared to 25% of Germans. For elective surgery, 90% of French patients undergo procedures within 4 months, compared to 62% of Canadians. If other nations can deliver timely access to care while preserving universal coverage, so can Canada. 2 changes, inspired by our peers, would preserve universal coverage and improve access. First, allow physicians to provide services to patients in both public and private settings. This flexibility incentivizes doctors to maximize the time they spend providing patient care, expanding service capacity, and reducing wait times for all patients. Those in the public system benefit from increased physician availability as private options absorb demand that would otherwise strain public resources. Second, permit private insurance for medically necessary services. This would allow Canadians to obtain coverage for these services, giving patients an affordable way to access healthcare options that best suit their needs. Private insurance would enable Canadians to customize their health coverage, empowering patients and supporting a more responsive healthcare system. These proposals may seem radical to Canadians. They are not. They are standard practice everywhere else. And across the OECD, they coexist with universal healthcare. Canada can imitate these successful models. Alberta has taken an important first step by allowing some physicians to work simultaneously in public and private settings through its new dual practice model. More Canadian provinces should follow and go one step further by removing legislative barriers that prohibit private health insurance for medically necessary services. Private insurance is the natural complement to dual practice, transforming private healthcare from an exclusive luxury into a viable option for Canadian families. The pride Canadians take in their healthcare system should inspire reform, not prevent it. Canada's healthcare crisis is real. It's a crisis of self-imposed constraints preventing our universal system from functioning at the level Canadians deserve. Policymakers can and should preserve universal healthcare in this country. But maintaining it will require a willingness to learn from those who have built systems that deliver universality and timely access to care, something Canada's current system does not.